Yeah, so it's very important that all the processes leading up to and including sterilization, of course, but there's a lot of processes before, and it's all multi-step, and each step is really it's heavily interdependent, isn't it? Like on each stage. So if you're not cleaning at point of use right after you're using it, if you say there's dental cement that it sets on the instrument, it's a lot easier to get off then and there than it is when you're trying to clean it or reprocess it in your sterilization area. So all those processes leading up to before you put it in your sterile pouch or wrap or whatever you're using to set, um, that it's properly cleaned, because an autoclave is not going to remove those pieces, the visual piece. It's the microscopic side of bacteria that we're eliminating when it gets put into the autoclave.